Hi guys, it's Adam. Just wanted to report in after seeing Dr. Fullerton for an assessment. It was just an assessment, there was no treatment. And to be honest, I'm glad that it was just an assessment. Yeah, even though I'm getting impatient with all these pains, I think he does a much better job when he isn't rushed. He spent just about 4 hours, just around 4 hours, poking and prodding, testing, and just seeing what's under the hood. And I think we found some pretty significant things. So my biggest priority is the pain in my lower back, and also the whatever it is that is making me stretch my neck like this and getting that crack, as was demonstrated in the previous video. And those were the two things. He can only do so much, so we take the biggest things, and those are the biggest. What did we find? He looked at my, I explained to him the symptoms and stuff with my back pain, and his first thought after I said everything was to look at my ribs. I was like, okay. So he looked at my ribs. He like pushed down. I'm lying on the table, and he pushed down on this side of my rib cage, and then he pushed down on this side of my rib cage, and this side was much more flexible than this side, which is not a good thing. He decided that was, probably a sign of some stretchiness, so that there's some ligaments and stuff in my ribs down here have probably been, the ligaments have been stretched. So he also checked out the right around here. And what he found was the ligaments did look disorganized a little, and also he saw that my my abdominal rectus, which is here, he noticed that right around that rib cage, the abdominal rectus is looking a little damaged, and he had me do an ab exercise, and I couldn't do it, at least very well. And then he pressed down on my ribs right there, asked me to do the same exercise, and I could. So looks like that is an issue, and it would make sense if this could be the source of my lower back pain, because I have real, let me show you. If I have issues, one thing is that my back keeps arching, and all this effort and stuff, shears the L1, makes things uncomfortable. So one thing that helps is engaging my core, including my abs. But it's hard to engage my abs, at least my abdominal rectus, because it's damaged. So if I get stronger abs because they're working, then I won't be tilting as much. I'll have more of a neutral spine, and neutral spine will make the lower back pain go away. So looks like I have some more damage to the ribs, and damage ab, and that could explain a lot. It could explain why Pilates is always so difficult. Could explain, again, why I have that lordosis, why I have that excess curvature in my lower back, and hopefully also explained the lower back pain that I'm experiencing. So that is what we looked at the front. Now on to the back. After seeing the video where the montage of me cracking my neck, he was very interested in that, one thing, so I'm very glad that I showed him, because I've told him about it before, and he's kind of ignored it because I don't think he realized the severity of the situation. So seeing it and hearing it, he was like, okay, we should really get this looked at, and looked at we did. Again, we found issues with my ribs. For those of you that might be seeing this for the first time, 20 years ago, I was in high school and a wrestler, and I was thrown to the mat on this side, and the guy had my arm like this, so I couldn't catch myself, so I just landed really hard. Cracked collarbone and tore rotator cuff, and those were the two things that were diagnosed at the time. seems that there was a lot more structural damage. Seems there's a little bit of damage around my the ligaments around my neck. There's also damage to the sternoclavicular joint. There's also damage to where my first and second rib attached to my sternum. There's also pit in the back of my capsule, shoulder capsule. Chunk of the labrum been kind of like taken out by the humerus, hitting the back of the capsule so hard. And now we also know that there was some damage to the ribs here, and the first and second rib that took the impact, that impact traveled around the rib cage back to where the ribs attached to the spine and also damaged that area. So he looked at the ultrasound, or under ultrasound, we saw some damage to the capsules where the first and second rib attached to the spine. So hopefully addressing that will help with some of the pains. And we also found damage to the serratus posterior superior. Now I've had issues with my serratus anterior addressed. The serratus anterior is kind of like around here. And never heard of the serratus posterior, but that muscle is pretty much exactly where I'm kind of experiencing pain. This right here is a nice little gif of the serratus posterior superior, and that is pretty much exactly where I'm trying to push in and getting that crack. So I'm really excited about getting my upper back treated, because it's possible that that's really all that I will be needed anymore with my upper back. Everything has been looked at, so it's hard to imagine any other muscles up there that haven't been looked at and haven't been treated. Levator, trap, everything and anything that's up there. Omohyoid. So yeah, hopefully getting this treated will resolve all the issues with my upper back. That's what I'm hoping. I always have hope. Reality is maybe something else will pop up, but I honestly, if anything else, if I stop getting that need to crack my neck and stuff, that will be a godsend, because it is annoying and it is just a part of my everyday life that I wish would go away, and it kind of lowers my quality of life. Like this pain that I'm experiencing right now. Yeah, I've been wanting it gone for 10 plus years, but and it's been getting better and better since I've been getting these treatments and been getting different muscles treated. But this is hopefully the last of the pain puzzle. Not as confident that the fixing of the ab will resolve everything regarding back pain and groin pain and stuff. That very well could be something else different, but got to do, at least for Dr. Fullerton, only can do really 2 things at a time, and then go from there. And with regards to the pain that I experience on my right side kind of hip flexor, like it's in that area, it hurts, like the oblique or whatever, but all that has been looked at and it all looks structurally sound. So the thought is that that is a victim and not a culprit. So keep looking for the culprit. Maybe the culprit is that, like not being able to work my ab, this has to work overtime, and that's causing it to be a pain. So who knows? What we do know is that there is damage here and that I can't really engage my abdominal rectus. So treating that, and then we go on to the next thing. And I'm going to see him, it's the 18th of October, and I'm going to see him in about a month. Middle of November, I forget the date. But super excited. I actually was going to be seeing him on the 13th of this month, so 5 days ago. But the sprinting group that I'm in is in a competition, or is hosting a competition, and I wanted to compete. So this could be stupid, but that's what I'm doing. So yeah, about 1 more month, and then might be fixed for the upper back. It might be fixed with the lower back as well. It's very exciting. All right, this is Adam, signing off.